Hi, I'm Kathleen Ronquillo, your student nurse from Section 11K, and for this video, I am going to do a return demonstration on how to perform the cardiovascular system. So without further ado, let's get started. Okay, so for now, cardiovascular system delivers oxygen, nutrients, hormones, and other important substances to the cells and organs of the body. It is important because it helps the body meet the demands of activity, exercise, and stress. Okay, so for now, first is we have to review the client's previous medical records if available so that we can have a better grasp of the patient's health. It enables us to see patterns and make more effective of the patient's health needs. The second one is we have to determine the scope of assessment needed. This can save time and will make the assessment smoothly. And lastly, don't forget to perform medical hand washing. Hello sir, good morning. How are you?
I'm fine.
Alright, so before we begin, I would like to introduce myself. I'm Kathleen Ronquillo, your student nurse for today. And for now, before we begin, I would like to verify some of your information. So what is your name, sir?
My name is Christian Paul Ronquillo.
Okay, so how old are you, sir?
18 years old.
Where do you live, sir?
Here at Mergus Cardiovascular.
Okay, sir, so what do you want me to call you?
You can call me Sir Paul.
Alright, Sir Paul. Okay, so for today, Paul, I am going to assess you prior to your cardiovascular system. And the purpose of this is to examine if there are any abnormalities that can be detected by inspecting your cardiovascular system. So for now, sir, do you have any questions, clarifications, or any concerns?
None so far.
Alright. So I assure you, sir, that all of your information will be kept private and we will be able to provide the best possible treatment. And I assure you, sir, that all of your information as well will be recorded. Okay, so for now, sir, before I start, I have to do hand hygiene first. Okay, so the purpose of this is to eliminate microorganisms. Okay, sir. So, for now, sir, before we start, I would like to interview ask some questions with regards to your current health, sir. All right. So, okay. Okay, so for now, sir, in medical history, have you ever been diagnosed with any heart circulation or conditions such as high blood pressure or coronary artery disease, peripheral vascular disease, high cholesterol, heart failure, or valve problems?
None.
All right. Okay, so have you ever had experienced shortness of breath or difficulty breathing?
None.
So, have you ever had a heart attack or stroke?
None.
So, in current health, sir, do you smoke?
Yes.
Okay. So, how many do you smoke daily?
Once a day.
Okay, so do you drink alcoholic drinks?
Yes.
How many alcoholic drinks do you have on average per day or per week?
Twice per week.
Are you physically active during the day?
No.
So, what does a typical day look like in your diet, or do you have caffeine or coffee during the day?
Yes.
So, if so, how much?
I drink coffee twice a day, once in the morning and once in the evening.
Okay. So, would you rate would you say you experience stress or at your life?
Yes.
Okay. How would you rate the amount of stress in your life from 0 to 10?
7.
Okay, so what do you usually eat?
All kinds of meat and sometimes only fruits.
Okay, so how many hours of sleep do you normally get each day?
4 to 5 hours.
Alright. Okay, so we're done with our interview. So for now, let's go to our assessment. Okay, sir, so before we start, can you please take off your t-shirt?
Okay.
Right. Okay. Can you put your arm here, sir? Okay, so now let's start. Okay, so for now, let's start with the jugular veins and carotid arteries. So first is we have inspection of these vessels. that can provide information about the blood volume and pressure in the right side of the heart. Position the client supine with the head of the bed elevated between 30 to 45 degrees, making sure that the head of and torso of the patient is on the same plane. The second one is we have to turn the patient's head slightly away from the side being examined and shine a tangential light source onto the neck and suprasternal area and area around the clavicles to observe for any pulsations or shadows. Okay, sir, so you can turn your head. Okay. Alright. Then, if jugular distension is noted, assess for the jugular venous pressure by locating the highest visible point of distension of the internal jugular veins. And as deemed necessary, raise or lower the bed until the highest visible point of the distension could be observed. Please let me touch. All right. Now is we have to measure the vertical distance in centimeter above the external angle by extending a long rectangular cord horizontally from this point of centimeter ruler vertically from the sternal angle, making an exact angle and repeat on to the other side. Okay. Okay, case for the next procedure is we're going to assess the carotid arteries. So first, with the head of the bed elevated at 30 degrees, slightly turn the patients and toward the side being examined. Okay, so can you turn here, sir? And we have to palpate for the carotid artery, weigh lightly to avoid blocking circulation or triggering vagal stimulation and bradycardia hypotension or even cardiac arrest, and then palpate the carotid arteries individually because bilateral palpation of the carotid arteries may reduce to cerebral blood flow. So we have to repeat onto the other side. Okay, next user. Okay, so next is we're going to use the stethoscope. We have to place the bell of stethoscope over the carotid artery and listen for the bruit. If bruit is heard, blowing or swishing sound that is caused by a turbulent blood flow through a narrowed vessel, which is an indicative of occlusive arterial disease, and repeat both sides. Users, can you face there? Okay, to the other side. Okay, so for the next procedure, I'm going to proceed by inspecting your chest area. So first is proceeding now to the inspecting of the heart or the precordium. So now is first begin with the general inspection of the chest wall. So for now is I'm looking to your chest wall, which I don't see any pulsations. I don't see any pulsation symmetry of the movement retractions, which I don't see. Okay, so next is simultaneously inspect the precordium for pulsations while palpating for aortic, pulmonic, tricuspid area. So first is we have to palpate for heaves and dips using the palm or hold the finger pads flat or obliquely against the chest. Alright. Okay, next is, for the thrills, press the ball of the hand firmly of the chest to check for a buzzing or vibratory sensation caused by underlying turbulent flow. So thrills are vibratory sensation left on the side overlying an area of turbulence which indicate a heart murmur caused by an incompetent heart. Okay. Alright. Okay, next is palpate for impulses using finger pads flat or obliquely on the aortic, pulmonic, tricuspid, and apical area. Okay. Next is palpated the apical impulse using the palmar surfaces of the 2 to 3 middle fingers. So I'm going to palpate for the apical area. Okay. Then, for finer assessment, palpated with one finger alone to confirm characteristics of apical impulse, noting for location, diameter, and amplitude. Okay. So now, if unable to palpate the apical impulse with the patient supine, reposition the patient to roll partly on the left lateral side. So palpate it again with the palmar surfaces of the fingers. Okay, sir, so can you please roll? Alright. I'm going to palpate. Okay. Roll on here. Okay, so if still unable to palpate, ask the patient to exhale fully and stop breathing for a few seconds and palpate again while the patient maintains to be partly facing on the left side. Okay, sir, so can you please roll again, sir? Okay, so can you inhale, exhale, and then hold for a second. Alright, inhale again, sir. Exhale, hold for a second. Alright. Okay, next is inspected and palpated of the epigastric area at the base of the sternum for abdominal aortic pulsation. Okay. Alright. Okay, next procedure is I'm going for the auscultation. First is I'm going to assess for the heart rate and rhythm of the patient by placing the diaphragm of the stethoscope on the patient's apical area. So the diaphragm is used for hearing high pitch sounds, while the bell is used for detect or differentiate low pitch sounds or gallops. Okay, next is using the diaphragm of the stethoscope first, and then the bell listen for the patient's heart sounds on its 4 anatomic sites, which are the aortic, pulmonic, the tricuspid, and the apical area. So first is I'm going to listen on the aortic area, which is found at the right sternal border in the second intercostal space. Okay, sir, so can you inhale? Inhale, exhale regularly, sir. Okay. Next is I am going to the pulmonic area, which is found at the left sternal border in the second intercostal space. Inhale, exhale regularly, sir. All right. Then the next one is I'm going to auscultate for the tricuspid area, which is found at the fifth intercostal space. Inhale and exhale, sir. Alright. And lastly is in fourth, lastly is in the apical area. Alright. Okay, next is repeated the preceding steps while the patient is in left lateral position and then sitting position fearing forward and briefly stop breathing after exhalation. Okay, sir, so can you please sit down? Can you please sit down and then lean forward a little bit? Lean forward a little bit. Alright. So I'm going to escort you, sir. Okay, sir. Alright. Okay, so support by luminal lay down, sir. Okay, so the next procedure is I'm going to inspect the arms and legs. So first is assess each arm for size, symmetry, skin color, temperature from fingers to shoulder, noted for any presence of edema, lesion, changes in skin texture, and hair distribution. Okay. Alright. Other one, sir. Okay, next is inspected the peripheral veins in the arms of the presence of superficial veins when limbs are dependent and when limbs are elevated. Okay, so we're going to inspect the veins. Alright. Okay, so the third one is palpated the radial, ulnar, and brachial pulse individually and bilaterally. Okay, sir, so first is I'm going to inspect your radial pulse. Okay, next is your ulnar. And then your brachial. Okay, so next is I'm going to palpate the radial pulse bilaterally both hands. And the next is the ulnar and the brachial. So I'm done palpating the three. So next is assessed for capillary refill. Okay. Alright. Okay, now is for the Allen test. This is to test the patency of the ulnar and radial artery, and then repeat onto the other side. All right, sir. So can you please open your hand, and then after squeeze it, after you close, and then squeeze it and hold it for a second. Okay. Okay. Start, sir. Okay, squeeze it, sir. Release. All right. Okay. To your next. To your other side, sir. Okay. Close, open, sir. And then release. Okay, open, sir. Okay, the next procedure is I'm going to examine the lower extremities, which is the legs. So first is at supine position, assess each leg for size, symmetry, and skin color and temperature from groin to toes, noted for any presence of lesion, changes in the skin texture, and hair distribution. Alright, so next is inspected the peripheral veins in the legs for the presence or appearance of the superficial veins when limbs are dependent and when limbs are elevated. Alright, other one, sir? Okay. Okay, next is palpated for femoral pulse, popliteal pulse, dorsalis pedia, and posterior tibialis individually and bilaterally. Okay, so first, sir, so, can you please raise a little bit your knee? Okay, the other one, sir. I'm going to inspect first the pulse, the back of the knee, sir. Alright. Next is I'm going to inspect your dorsalis. And then your posterior. Alright. Okay, then assessed for the peripheral veins for signs or ulceration, varicositis, and thrombophlebitis. So first is we have to inspect the calves for ulceration, varicositis, redness, and swelling over the vein sites. Okay. Other one, sir. Next is we're going to palpate the calves for firmness or tension of the muscles, the presence of edema over the dorsum of the foot, and then the areas of localized warmth. So push the calves from side to side and then test for tenderness. And then firmly dorsiflex the client's foot while supporting the entire leg in the extension or the Homan's test for had the client to stand or walk. Okay, so I'm going to flex your foot, sir. Then, assist for capillary refill for both legs and repeat the preceding steps with the other leg. I'm going to pinch a little bit, sir. Okay, so now we're done with our assessment. So we're going to have our summary and closing phase. Okay, Paul, so to sum up everything, when elevated in the supine position earlier, your distended neck vein does not collapse, which indicate an abnormal elevated venous pressure, and your heart rate is 110 beats per minute, which is abnormal. So upon assessment of your upper and lower extremities, your arms and your legs are bilaterally symmetric or balanced proportion with minimal variation in size and shape, and there's no swelling or there's no lesions or injury. And your capillary feel or the color of your toes and fingers, your arms and legs after pressuring are normal. It's back to its position at 2 seconds, but your radial, your ulnar and your brachial pulses are bilaterally strong and has irregular rhythm, which is not normal, causing of drinking coffee, and I see that you are sensitive to caffeine and you consume excessive amount of coffee for the day. That's why you are palpating after you are drinking coffee, and your blood pressure too is temporarily increasing. And upon performing the Allen test, where you close and open your hands, you can close your hand properly because you are shaking or you're slightly shaking, which cause of your nervousness, and your skin is cold. So, however, upon examining your legs, your legs here, it is evenly distributed, and then there's no edema, no swelling, no lesions or injury presence. And the pulses of the back of your ankle part, or the posterior tibial, the back of your knee, which is your popliteal, and the dorsal artery or foot are all abnormal. They are equally strong and has irregular rhythm. So overall, your cardiovascular system is not doing so well. So I recommend you that you should keep on consuming healthy foods, less intake of oily and fatty foods, and have a good diet. And as much as possible, you have to eat fruits and vegetables, and then do regular exercises. So this will help you to have a healthy body and away from illnesses. Okay, so you have to stay hydrated, and it's okay to drink coffee since it has benefits. However, taking excess amount of coffee can actually cause very unpleasant symptoms of heart palpitations, or you could get tachycardia or the fast resting heart rate. You can also get severe dizziness, severe shortness of breath, fainting, and other symptoms. And that's why you should only take less amount of coffee. Okay, so while you palpitate again, sir, and you have any symptoms of heart palpitations, I encourage you to check up again and for further informations and for further examination. Right, sir? So for now, Paul, do you have any questions, clarifications, or any concerns? All right, sir. So thank you very much, Paul, for your cooperation. Have a good day.